Dear participants, welcome to the SWAYAM course. This is the week 2 lecture number 1 and the course is Introductory Animal Physiology and the title is the cardiac cycle, cardiac output and its regulation. So, myself and Dr. Mukesh Kumar Bharati, I am assistant professor in the Department of Veterinary Physiology and Biochemistry, Faculty of Veterinary and Animal Sciences, Banaras Hindu University. So, the overview of this chapter is that what are the things we are going to discuss in this chapter is that first we will discuss about the cardiac cycle, then the phases of the cardiac cycle, then we will see what are the heart sound are there, then we will see cardiac output and their regulation, how cardiac output has been regulated, and then finally we will see what is called as a cardiac index. So now we'll start with the cardiac cycle. What is called as a cardiac cycle? So cardiac cycle is defined as the events that is taking place by the beginning of one heartbeat to the beginning of next heartbeat. One cardiac cycle is the beginning of one heartbeat to the beginning of next heartbeat. So each cycle is initiated by spontaneous generation of action potential in the sinus node and the action potential that travel from the SA node rapidly through the both atria and through the atrioventricular node into the ventricle. Some delay is takes place, as I have already discussed in the previous class that some delay has been takes place at the AV node, and that delay is important for the proper filling of the ventricle. So thus the atria act as a primer pump. Atria act as a primer pump for the ventricle, and the ventricle in turn provide the major source of power for moving the blood through the body vascular system. So that is the overview of the cardiac cycle. So if we will talk about the in detail, the cardiac cycle is split into two phases. One is called as a systole and another is called as a diastole. Systole means the contraction phase of the heart and diastole is the means relaxation phase of the heart. So broadly it is divided into systole and the diastole, and each of these means systole and diastole is further divided into the atrial and the ventricular, means atrial systole, atrial diastole, ventricular systole and ventricular diastole. So cardiac cycle means depicts the what is mainly this cardiac cycle is depicting. It depicts the change in the blood pressure and the volume. Change in the blood pressure and the volume in the left and right atrium and the ventricular, and the pressure change in the aorta and the pulmonary artery during the cardiac cycle. So mainly cardiac cycle involves the change in the volume and pressure in the auricle and the ventricle. So whatever the volume is changing means when the filling will takes place, the volume will change, means pressure will change, and when the it will empty, the pressure will decrease. So that is the relationship between the pressure and volume during these phases. Each cardiac cycle correlates the pressure change, the volume change, the valve activity, whether it is opening or closing, the electrocardiogramic features, the what are the electrocardiogram depicts during the cardiac cycle, and the heart sound during the systole and the diastole. Heart sound means during the closure of the valves, the different types of sound will be there, so that heart sound will be seen during the systole and the diastole. So all these things will correlate the cardiac cycle. The cardiac cycle proceed in 4 stages. One is first is called as atrial systole, then atrial diastole, ventricular systole and ventricular diastole. So atrial systole will last for 0.1 second. In this, both atria will contract and force the blood from the atria into the ventricle. So in this phase, atrial systole, atrium will contract and it will force the blood into the ventricle. Next is the ventricular systole. Ventricular systole will last for 0.3 second, and both in this phase both the ventricle will contract and blood is forced into the lung via the pulmonary vein and into the rest of the body via the aorta. So, in this phase means ventricular systole, both the ventricle will contract and it will force the pump the blood to the respective means body size. Then comes to the atrial diastole, that will last for around 0.7 second. Here the relaxation of atria will take place, during which the atria fills with the blood from the large vein. So, during atrial diastole, diastole means the relaxation phase, and during the relaxation phase the mainly filling will takes place. So, during diastole filling will takes place both atria as well as the ventricle. Then next is the ventricular diastole, that will last for 0.5 second, and here the relaxation of ventricle will takes place, allowing the ventricle to fill passively with the blood from the atria. So, altogether one cardiac cycle is for 0.8 second. Total time for one cardiac cycle is 0.8 second. These are the events of cardiac cycle. What are the events takes place during cardiac cycle? So, as I have previously I have told that it is a relationship between the pressure change and the volume change in the heart. So, here we can see the different types of changes has been taking place. Here is it is the aortic pressure, how the pressure are there in the aorta. Then this is the dotted line is the atrial pressures, means the whatever the pressure change is taking place in the atrium. Then this red line is called as a ventricular pressure, means the pressure which is changes takes place during in the ventricle. Then this is the ventricular volume, blue line is the ventricular volume, and this cardiac cycle also give the indication about the electrocardiogram, what are how the changes has been takes place in the ECG, and also the heart sound that is means recorded by the phonocardiogram. So, it is an interrelationship between the different kind of changes that is taking place in the during the cardiac cycle. So, these are the phases of cardiac cycle. Phases means different phases are there in the cardiac cycle. One is first is called as a isovolumic contractions, then there will be the rapid ejection phase, reduced ejection phase, then comes to the protodiastole, then comes to the isovolumic relaxation, then the phase will come the rapid filling phase, then reduced filling phase, it is also called as a diastasis, and finally comes the phase that is the atrial systole. So, one by one I will brief all the phases, what are the events has been taking place in the different phase of the cardiac cycle. So, in the first phase isovolumic contraction, here what is happening, there is the onset of the ventricular contractions. So, what will happen, there will be the closure of the AV valve. So, the rapid rise in the intraventricular pressure with no volume change. So, it is called as a isovolumic contraction, means the contraction will takes place but volume will not change, isovolumic contractions. Then next phase is called as a rapid ejection phase, where the opening of the semilunar valve will takes place and the rapid flow of blood will takes place from the ventricle. So, that is called as a rapid ejection phase. The next is the reduced ejection, means there will be the decline in the ventricular pressure, and once the decline in the ventricular pressure will takes place, there will be the slow outflow of blood from the ventricle. So, that is called as a reduced ejections. Next is called as a protodiastole. Here the onset of ventricular relaxation will takes place. Now, the ventricle will start relaxing. So, that is called as a protodiastole. Here the rapid decrease in the intraventricular pressure will takes place. The pressure will now start decreasing. So, that is called as a protodiastole. Next is the isovolumic relaxation. Isovolumic relaxation means relaxation will takes place, but there won't be change in any volume of the blood. So, that is called as isovolumic relaxation. Here closure of the whatever the opened semilunar valve was there, here the closure of semilunar valve will takes place, and there will be the continued ventricular relaxation with no volume change. So, that is called as a isovolumic relaxation. Next stage is called as a rapid filling. Now, what is happening here? The AV valve will open. So, there will be the rapid flow of blood from the atria to the ventricle. Now, the rapid blood will flow rapidly from the atrium to the ventricle. Then next is called as a reduced filling or diastasis. Here the slow rate of flow from the atria to the ventricle, and this will continue slow filling of the ventricle. Then last phase is called as a atrial systole, means there will be the onset of atrial contraction. Atria will start contracting. This is called as a atrial systole, and the pressure within the atrial chamber will increase. Once the atrium will start contracting, the pressure within the atrium will start increasing. So, these are the 8 phases of cardiac cycle: isovolumic contractions, rapid ejections, reduced ejections, protodiastole, isovolumic relaxation, phases of rapid filling, phases of reduced filling, and atrial systole. So, all the events have the different significance. We will see how the atrium will function and how the ventricle are getting filled, how ventricle filling is takes place. Blood normally flow from means continually from the great veins into the atria, and because of the opening of the atrioventricular valve, around 80% of blood will flow directly from the atria into the ventricle before the atrial contraction. So, once the AV valves will open, around 80% of blood will flow from the atria into the ventricle without contracting the atrium. So, after that the atrial contraction will start, and then the whatever the additional 20% blood is there in the atrium, that will come into the ventricle. So, 80% will flow without atrium contraction, and the rest 20% will flow by the atrial contractions. Therefore, the atria functioned as the primary pump that increase the ventricular pumping effectiveness as much as 20%. However, the heart can continue to operate under the most conditions even without this extra 20% effectiveness, because it normally has the capability of pumping around 300 to 400% more blood than is required by the resting body. So, heart does not require the primary pump, ventricle can also operate by itself only. Now, the emptying of the ventricles during the systole. How the ventricle will empty during the systole? One important phase is called as a period of isovolumic or isometric contractions. So, immediately after the beginning of the ventricular contraction, the ventricular pressure will rise abruptly, causing the closure of the AV valve. Then an additional 0.02 to 0.03 second is required for the ventricle to build up the sufficient pressure to push the semilunar. Semilunar are two types of valves are there, that is aortic and the pulmonary valves will open against the pressure in the aorta and the pulmonary artery. Therefore, during this period contraction is occurring in the ventricle, but there is no emptying. So, that is why called as a period of isovolumic contraction. This is called of isovolumic or isometric contraction, meaning that the tension is increasing in the muscles, but little or no shortening of muscle fiber is occurring. So, that is why it is called as a isovolumic or isometric contraction. Period of ejection. What is called as a period of ejections? So, when the left ventricular pressure rises sufficiently, the ventricular pressure pushes the semilunar valve open. So, once the ventricle will fill with the blood, then the semilunar, it will create pressure on the semilunar valves, and then the semilunar valve will open. So, immediately blood will begin to pass out of the ventricle, with about 70% of the blood emptying occurs during the first third of ejection period, and the remaining 30% emptying during the next 2/3 of the ejection period. So, we have discussed the period of filling of the ventricle. Now, we are discussing about the period of ejection, how ejection is taking place. So, here it is saying that around 70% is ejection taking place during the first third of the ejection period, whereas the rest 30% is taking place during the next two-thirds of the ejection period. Therefore, the first third is called as the period of rapid ejection and the next two-thirds is called as a period of slow ejection, rapid ejection as well as the slow ejection. So, this is the how the ejection has been taken. Earlier we have discussed about the period of filling, how filling has been takes place. Now, what is the relationship of ECG to the cardiac cycle? ECG have different wave front that we will discuss separately, but here I am going to give a brief idea about the ECG, that ECG have three different wave front: P wave, QRS complex and T wave. So, during the cardiac cycle, the P wave is caused by the spread of depolarization through the atrium, followed by the atrial contractions, which causes the rise in the arterial pressure. Then QRS waves appears as a result of electrical depolarization in the ventricle, which initiate the contraction of the ventricle and causes a rise in the ventricular pressure. So, P wave is mostly related to the atrial contraction, whereas the QRS complex is mostly related to the ventricular contractions. The T wave represents the stage of repolarization of the ventricles when the ventricular muscle fiber begin to relax. So, that is represent the T wave. So, in this way P wave, QRS complex and T waves relate the cardiac cycle. Now, some important definitions are there, like end diastolic volume, end systolic volume and stroke volume output. So, one by one we will discuss about all the definitions. So, end diastolic volume, what is the end diastolic volume? During diastole, the normal filling of the ventricle increases the blood of each ventricle to around 110 to 120 milliliters, and this volume is called as a end diastolic volume. What is called an end systolic volume? The amount of blood remaining in a ventricle after the ventricular contractions. So, once the contraction will be over, after that also if some amount of blood is left in the ventricle, that is called as a end systolic volume. What is the end diastolic volume? End diastolic volume is the volume of blood that remain during the diastolic period. Then third is called as a stroke volume. Stroke volume is the volume of blood pumped by ventricle per beat. Volume of blood pumped by ventricle per beat, and this value is around 70 milliliter. So, stroke volume is equal to end diastolic volume minus the end systolic volume. So, diastolic volume minus systolic volume will be the stroke volume, and its value is around 70 ml. Now, next is the called as the ejection fraction. Ejection fraction is the percentage of end diastolic volume that is pumped by the ventricle. Ejection fraction should be around 55 to 60% or higher than that. So, that is called as a ejection fraction. Now, we will discuss about the heart sound. Different heart sound is heard during the closure of the different valve. Okay, there are mainly four types of heart sound: first heart sound, second heart sound, third heart sound and the fourth heart sound. So, the first heart sound is also called as a lub sound, and this will be heard when the AV valves close. When the atrioventricular valve will close, at that time this means heart sound will be heard, and it will heard at the beginning of the ventricular systole. What is the properties of this first heart sound? This will be the soft sound, low in pitch and relatively for the longer duration of time. It is soft in pitch, soft, low pitched and for the longer duration of time. Next is called as second heart sound or dub sound. This will be heard when the semilunar valve will close. So, at the end of closure of this semilunar valve, second heart sound, that is the dub sound, will be heard. And what is the property? It is hard, high pitched, and but it is for shorter duration of time. It is for the shorter duration of time, but it is a high and hard pitch. Third heard sound, occasionally a weak, very feeble sound is heard at the time of the ventricular filling. This heard sound is heard at the time of ventricular filling. The frequency of this sound is so low that ear cannot hear. By means, if you want to hear this sound by the ear, you cannot hear, yet it can often recorded in the phonocardiogram. So, by phonocardiogram this sound can be heard, but by natural ear you cannot hear this sound. Then fourth heard sound produced at the time of atrial contractions. So, at the time of atrial contraction, fourth heard sound can be heard, but this also cannot heard through the stethoscope, but it can be recorded in a phonocardiogram. So, both third heard sound and the fourth heard sound can be recorded through the phonocardiogram only. It cannot be heard through the normal stethoscope. So, these are the four heard sound that's heard during the different closure of the valve. Then another important term is there, that is called as a heart murmur. What is called as heart murmur? Heart murmur is a general term for any abnormal heart sound. So, if any abnormal heart sound will be there, if that is not according to the closure of the normal valves, then that is called as a murmuring sound. So, any kind of abnormal means closure of the valve that produce the sound, that is called as a murmur. So, abnormality in the heart valve are commonly are the cause of the heart murmur. So, how it will occurs? It may occurs when a valve fail to close completely. Okay, when means the valve will fail to close completely. It may be due to the valvular insufficiency. If valve does not close properly, at that time when the sound that kind of sound is produced, that called as a murmur sound, and the blood flow goes in the wrong direction at the wrong time, because the proper closure of the valve is not taking place. Murmur may also occurs when a valve fails to open completely. First was that when it does not close completely. Second is that when the valve will fail to open completely, that is called as a valvular stenosis. Stenosis means the constrictions. If it will not open completely, then also some kind of sound will be heard, that is also termed as a murmur sound. And in this case, the blood is forced through the smaller than the normal opening. So, what will happen if the stenosis will takes place, the constriction of the valve will takes place, and if the blood will flow through that opening, that will create much kind of pressure, okay, and then that also produce some kind of sound. It may be due to the improper or the defective closure of the either mitral valve, tricuspid valve, or due to the stenosis of the pulmonary or the aortic valve. So, it can be occurs due to all these type of valve. So, this is called as a heart murmur. Next is the cardiac output. What is called as a cardiac output? Cardiac output is the amount of blood pumped by the ventricle per minute. In 1 minute, how much amount of blood is pumped by the ventricle, that is called as a cardiac output. It is the product of heart rate and the stroke volume. Okay, it is the multiplication of heart rate and stroke volume. So, cardiac output may mostly depend upon the what is the heart rate of the particular animal species and what is the stroke volume of that particular species. So, it depends upon both heart rate as well as the stroke volume. So, the cardiac output, if we will calculate, means for the normal means human being, it will comes around 5040 ml per minute or 5.04 liter per minute. In case of the horse, the stroke volume is around 800 to 900 ml, and in case of the cow, the stroke volume is around 600 to 700 ml. So, if you will calculate the cardiac output in case of the horse and the cow, the cardiac output in case of horse, it will come around 31.5 liter, and in case of the cow, it will come around the 39 liter, because the heart rate and the stroke volume is different in these species. That is why the cardiac output is also different in the different animal species. Cardiac output and venous return must be equal to each other, because the cardiac output is mostly depend upon the venous return. Venous return means how much amount of blood is returning to the heart. So whatever the amount of blood we return to the heart, that will decide whatever amount, what should be the amount of cardiac output will be there. Cardiac output will varies with the level of the body activity. So if we will do more amount of work, more amount of more cardiac output will takes place. If we will do the less activity, the less cardiac output will takes place. Another important thing in definition they call as a cardiac reserve, that is the difference between the maximal cardiac output and the cardiac output at the rest. So what are the factors which maintain the cardiac output? The factors which maintain the cardiac output is the heart rate, venous return, stroke volume, force of contraction of the heart, total peripheral resistance, and the blood volume. Already we have discussed in brief the how it affect, because heart rate means directly proportional to venous return is directly proportional, stroke volume is also directly proportional to the cardiac output, the force of contraction of the heart is also directly proportional, and total peripheral resistance. If resistance will be high, the cardiac output will be less, and it will also directly proportional to the blood volume. Then what are the factors affecting the heart rate? The cardiac output is directly proportional to the heart rate. Moderate change in the heart rate does not alter the cardiac output. So these are the certain factors which also affect the cardiac output, like oxygen supply. Reduced oxygen supply will weaken the heart muscle, and it will directly affect the cardiac output. If oxygen supply will be less, cardiac output will be less. Then temperature will directly proportional to the heart rate. If high temperature will be there, high cardiac output will takes place. Then hydrogen ion concentration means the change in the pH will affect the heart rate. High pH will decrease the heart rate, and low pH will increase the heart rate. Then potassium ion concentration, high potassium ion concentration will decrease the heart rate, and whereas the high calcium ion will increase the heart rate. Calcium ion have the directly proportional to the heart rate. And also the sodium ion concentration. Sodium ion concentration, if it will decrease, it will also decrease the heart rate. Other factors that influence the cardiac output is the muscular exercise, pregnancy, hypoxia, active digestion, stress, and the increased body temperature. Muscular exercise, as we know that if you do the more exercise, more cardiac output will take place. During the pregnancy, requirement of blood is much more, that's why high cardiac output takes place. In the hypoxia, there is a less oxygen supply, so that's why the more cardiac output should takes place to compensate the loss of oxygen. Then if during the active digestion, high amount of blood is needed for the digestion, so that's why the cardiac output is increasing. During the stress, we require more amount of blood, that's why the cardiac output is also increasing. And body temperature, if high body temperature is there, then naturally the cardiac output will increase. Now certain conditions are there that will decrease the cardiac output. So what are the conditions? Severe coronary blood vessel blockage. If any kind of blockage will be there, that will decrease the cardiac output. Then if inhibition of the nervous excitation will be there, that will also decrease the heart rate. Any factors that causes abnormal heart rhythm, that will also decrease the heart rate. If there will be the valvular heart disease, or if there will be the myocarditis, or if any kind of cardiac tamponade, means the heart will be surrounded by the fluid, then also the cardiac output will decrease. And the atrial fibrillation, if means coordinate contraction will not takes place, then also it will affect the cardiac output. Now decrease in the cardiac output takes place by the non-cardiac peripheral factors. Certain factors are there that is not directly related, like decreased blood volume, acute venous dilatation, or the obstruction of the large veins. All these factors will decrease the cardiac output. The factors which influence the ventricular performance, there are certain terms are there that we need to understand. One is called as a preload, means whatever amount of blood is required to fill the ventricle, that is called as a preload. Then afterload means the amount of work that is need to eject the blood, that is called as a afterload. Then inotropy, heart rate and the lucitropy. Here we need to understand the term that is called as a lucitropy. Lucitropy means the relaxation state of the heart. So, this lucitropy is important because if proper amount of relaxation will not takes place, then the proper feeling of heart will not be takes place. Next is the how the regulation of cardiac output is takes place. Cardiac output regulation is takes place by two important mechanisms. One is called as a intrinsic regulation and another is called as a extrinsic regulation. Intrinsic regulation is takes place by two means. One is called as a homeometric autoregulation and another is called as a heterometric autoregulation. So, blood the cardiac muscle, the homeometric autoregulation means the cardiac output is changed without change in the length of the cardiac muscle fiber. So, that is called as a homeometric autoregulation. Heterometric autoregulation is the cardiac output is changed due to change in the length of the cardiac muscle fiber. This is called as a Frank-Starling law. So, heterometric autoregulation is called as a Frank-Starling law. Here the fiber length is changed as the requirement is taking place for the means pumping of the blood. Now, the extrinsic regulation of heart, extrinsic regulation of heart is taking place by the two means. One is called as a nervous regulation and another is called as a chemical regulation. Nervous regulation of heart takes place by the sympathetic and the parasympathetic division of the autonomic nervous system. So, sympathetic nervous system will accelerate the cardiac output, whereas the parasympathetic nervous system will decrease the cardiac output. The chemical regulation of the heart takes place by the catecholamines, the acetylcholine and some metabolic end product. Catecholamines, mostly the epinephrine and norepinephrine, it will provide the positive chronotropic and the inotropic positive inotropic effect on the heart, means it will enhance the cardiac output, whereas the acetylcholine will do the negative effect, means it will decrease the cardiac output. Then metabolic acid end product like carbon dioxide and other metabolic acid product such as hydrogen ion, lactic acid lower the pH below the normal and it will causes the increased rate and force of contraction of the heart. Finally, the cardiac index is defined as the cardiac output per square meter of the body surface area. So, it is expressed in the liter per minute per meter square. Cardiac output increase approximately in proportional to the surface area of the body. It will allow the comparison of the cardiac function between the individuals of the different size. So, this is the useful marker of how well the heart is functioning as a pump by directly correlating the volume of the blood pumped by the heart with the individual body surface area. So, today's lecture I discussed the what is called as a cardiac output, what are the factors it regulate the cardiac output, and also we have discussed about the cardiac cycle and what are the phases of cardiac cycle, what are the means how it is getting regulated. In the next class we will discuss about the electrocardiogram and the other functions of the heart. Thank you.